tubercle of humerus. That's all about muscles of shoulder girdle. Let's repeat all together. What you remember? I show you, give names. This one.
Clavicle.
No. Deltoid muscle. This one. Big. Spine. So below. Infraspinatus. Above. Supraspinatus. This one. Lesser teres and greater teres. Okay. And else. Here, name? Subscapular. Yes, subscapular muscle, correct. So muscles of free upper limb divides on three groups. This one, muscles of the arm, muscles of the forearm, and hand muscles. Yeah. Anterior muscles, its functions, all are flexors. Posterior muscles, all are extensors. So arm muscles divides on anterior and posterior groups. Here, anterior muscles all are flexors. Their names: biceps femoris, femoris, господи, femoris, and my lower limb. Biceps brachii muscle. It has two heads. This one short head. It starts from coracoid process of scapula, and this one long head. It originates from supraglenoid tubercle of scapula. This muscle passes through articular cavity of shoulder joint, then through groove, intertubercular groove. After that, it attached to with the short head. And biceps brachii muscle attached to radial tuberosity. Together with short short head, start coracobrachial muscle. This one, coracobrachial, from coracoid process of scapula to humerus. And else one of this group, brachial muscle. Three muscles must be. Once more at these extremities. Let's repeat. This one, biceps brachii, biceps brachii. This what is it? Long, and here is short head. Together with short, else one, coracobrachial and brachial muscle. Brachial muscle attached to ulnar tuberosity. Biceps brachii to radial tuberosity, brachial muscle to ulnar tuberosity. That's all anterior muscles. They are flexor. What? Forearm in elbow joint and arm in shoulder joint. On posterior surface, extensor muscles, and here only two muscles. This one, triceps brachii muscle. It has three heads. This one, long head. It originates from infraglenoid tubercle of scapula. This one, lateral head, and in between them here, a medial head. These heads start from dorsal surface of humerus. Attach this muscle to olecranon. Olecranon, this process of ulnar bone. Yeah? And else one short little muscle. Its name olecranon muscle. Not very good thing, but it passes from medial epicondyle of humerus and attached to medial body of olecranon. That's all posterior muscles of the arm. Yes, only two, triceps and olecranon muscle. Now muscles of forearm. Forearm muscles divides also into two groups: anterior flexor muscles and posterior extensor muscles. All these flexor muscles start from medial epicondyle, except one, this one, coracobrachial. Coracobrachial. Here, this one, brachioradial muscle. From humerus to radius above styloid process it attached. Except this muscle, it starts from lateral. Other all origin from medial epicondyle. And four lays. First lay here. Flexor carpi radialis muscle. It attached to base of second metacarpal bone. This one, this muscle is not constant. It's named palmaris longus. It continued to palmaroponevros. And there's one muscle at this lay, flexor carpi ulnaris muscle attached to base of fifth metacarpal bone. This one superficial lay. Also to this lay here, it's named pronator teres. It has two heads, superficial head and deep head. Between these two heads passes median nerve. And there's one brachioradial. Yeah, 1, 2, 3, 4, 5. This is superficially. Take away these muscles and we can see secondly. Secondly includes only one muscle. It's named flexor digitorum superficialis. It has one valley and 4 tendo, divides on 4 tendo, which goes through fingers, basis of proximal phalanges from second to fifth fingers. This one, its name, once more repeat, flexor digitorum superficialis. Take away secondly, and we can see here thirdly. Thirdly includes two muscles. This one, flexor digitorum profundus, deep flexor digitorum muscles. It also divides on 4 tendo and attached to bases of distal phalanges from second to fifth fingers. And there's one muscle at this group, at this lay, its name flexor pollicis longus. Flexor pollicis longus. Two muscls thirdly. Take away it. And we can see fourthly, deep lay, fourth, only one muscle here. It's named pronator quadratus muscle. Transverse fibers between ulnar and radius bones. So, anterior muscles, two types, two functions, flexors and pronators. There are two pronators, teres and extensors. Here two lays, superficial and deep. All extensors start from lateral epicondyle. Flexors origin from medial epicondyle, extensors from lateral epicondyle. And here we can see what? This one. Here. Extensor carpi radialis longus and extensor carpi radialis brevis. Long and short extensor carpi radialis muscles. Long attached to base of second metacarpal bone, its dorsal surface, and short attached to base of third metacarpal bone, also on dorsal surface. This muscle attached to fifth metacarpal, its name extensor carpi ulnaris muscle. Yes, between them, radialis and ulnaris, here we can see one extensor digitorum longus muscle. Extensor digitorum. It divides on 4 tendo and attached to fingers from second to fifth. Else, except this muscle on the center, we can see 2 tendo which goes to index and to digiti minimi. Yes? So one part of tendo, this extensor digitorum, and there's one different muscle, extensor indicis, its name. And this one, extensor digiti minimi. And else, 3 muscles which goes to first finger, 3 muscles, 1, 2, 3. They have different attachment. So to base of first metacarpal bone attached adductor pollicis longus muscle. Next muscle to see tendo continue to base of proximal phalanx. Its name extensor pollicis brevis. And this muscle continue. This muscle is longer. It goes attached to base of distal phalanx. So its name extensor pollicis longus muscle. Understood? Yes. Once more repeat 3 muscles. First is adductor. Adductor pollicis longus. This muscle, next, extensor pollicis brevis, and this one extensor pollicis longus. 3 muscles attached to first finger, and here between these muscles we can see radial artery. This one, radial artery, it first passes on the lateral groove on forearm anterior surface, then it goes to dorsal surface, to first interossal space, and after under all flexors goes to palmar surface of the hand and attached to with the ulnar artery and forms deep palmar arch. About vessels later, other classes. So today about muscles, and else we said that on anterior surface there are 2 pronators, teres and quadratus. Yeah? But of course must be supinator. Supinator muscle around radius here, fibers of this muscle, this one, supinator muscle. Do you see? This one, supinator muscle. Once more repeat here, this one, what I showed. No? What name this muscle? What time is it now?
I'm sorry, I was not aware of the timings.
You was absent on the lecture. No? What name?
Superior.
Superior. No superior. Function.
Posterior.
Function. All muscles. Function. Extensor. Extensor carpi radialis. This one longus and this one brevis. Only one flexor carpi. Yeah? This one flexor carpi radialis. 1 extensor, 2 long and short. This one 2/5 metacarpal attached. What name muscle? Extensor carpi ulnaris. Ulnaris. 1 muscle here, other side, flexor carpi ulnaris. Yeah? This extensor carpi ulnaris. Yes. This one goes 2 fingers, so its name extensor digitorum longus. But on anterior surface there are 2 flexor digitorum, superficial and deep. Do you remember? Yeah. Else, what we can see else? 2 tendo goes to index. So extensor indices and 2 tendo, 2 muscles goes to digiti minimi. So its name extensor digiti minimi. And if on anterior surface 2 pronators, on posterior 1 supinator muscle. Supinator muscle. That's all about these muscles. And those muscles of the hand, here are 3 groups: lateral muscles or tenor, hypotenor or medial muscles, and between these 2 else 1 intermedial group. Tenor muscles, very simple. What we can to do by our first finger? What function we can to do? We can flexor, we can extensor, abductor, and opponents. So same muscles, and there's one moment on the forearm. All muscles are long. On the hand, muscles are short. So flexor pollicis brevis muscle. Yes, extensor pollicis brevis, but here at this group, this muscle absent because it present on dorsal surface. This one, extensor pollicis brevis. So, or at this it will be absent. Next function, what? We said that this muscle is named abductor pollicis longus. So will be abductor pollicis brevis. And there's one here. This opponent's muscle. Same muscles of hypotenor, what function? Flexor digiti minimi brevis, extensor digiti minimi brevis, and opponent's muscle. And medial muscles, interosseous, plantar, palmar surface, or anterior interosus and dorsal interosus. And those here are 4 lumbricate muscles. There's names first lumbricate, second, third, and fourth. Yes. And those except muscles, you must know elements of topography. For example, axillary cavity. Axillary cavity, it has 4 walled closed.